Hi, Tova. I'm Dr. B. Nice to meet you.
Nice to meet you.
Thank you for coming in today. Glad to have finally gotten you on the roster for the appointments. I know we've been a little backed up with scheduling. I do apologize. But we want to just do, first time seeing you, get a baseline check and do a HEENT exam and a cranial nerve exam. Since we specialize kind of in the neurological side of things here, make sure everything's functioning well. If there are no problems, great. You come back in 2 years, we do it again, okay? Any questions before we begin?
I don't think so.
Okay. So what I usually do is just sort of run down the systems from the head to the neck. Any headaches or pain in the head generally?
Not in the head.
Not in the head. Okay, where is there pain?
I would say more in my neck.
So pain in your neck?
Mm-hmm.
Okay, let me sanitize my hands here. I just want to feel there. We'll sort of investigate as things come up. Okay, so this around here, sort of on the, from that occipital down,
Yeah, around there.
to the trapezius muscle. And the same thing on the other side as well?
Yeah, I would say it's pretty equal on both sides.
Pretty equal, okay. Is it tender when I touch, or does it feel kind of good, like a massage?
It feels kind of like a massage.
Okay, ooh, do you feel that right there?
I did feel
okay,
that.
so you have a big knot of tension.
Yeah.
Not feeling that specific thing on that side, but yeah, that's a pretty good indication that that's a muscular tension thing, but
Okay.
I do want to definitely check the cranial nerves, especially when it comes to the nerves and the strength in the neck, to see if any of that's affected.
Okay.
Moving down to your eyes, any blurry vision? Do you wear corrective lenses at all?
I do sometimes for seeing far away, but other
Okay,
than that,
so you have slight nearsightedness. Okay, and do you feel like your prescription is up to date? Okay. Any issues with hearing? You're obviously hearing me and responding, but any itchiness of the ears or blockages in the ears?
I don't think so.
No feelings of like fullness? Okay. Any changes to your smell or having trouble breathing through one of your nostrils?
Not at the moment, no.
Okay, great. Well, yeah, I mean, obviously if you get sick or something, that can happen, but as long as it's not a consistent thing, we're not worried about deviated septum or anything like that. Okay, any changes to your taste or sores in the mouth?
I do get canker sores sometimes.
You do
but
get canker sores,
other
okay.
than that-
Are those, do you feel like you are able to keep those under control, or are you looking for further treatment?
I mean, further treatment would be great.
Okay,
if possible.
so we'll take a look into the mouth and we'll kind of see if there's any obvious signs of sores today, but
Okay.
with those, you tend to treat them when they come up.
Yeah.
So if there's no active sores today, there's not too much we can do, but we can absolutely try something a topical or something mouthwash that you can flush around, and that will help heal those up a little faster.
Cool.
Okay, and you said there was some pain in the back of the neck. Anything in the front of the neck? Any trouble swallowing?
I don't think so.
Okay. All right, so I'm going to go ahead and get started then. And again, I'm just going to work my way down the system. I'd just like to put on gloves for the head, and we'll do the mouth as well later with gloves. But any itching in the scalp or pain in the scalp?
Some itching.
Some
yeah.
itching, okay. Specific place or just sort of all over?
I would say more like in the back.
Okay. Let me take a look back there. So I'm just going to come around. And just relax. I'm just going to look through the hair. So I'm not really seeing too much redness. No signs of rash. Scalp isn't too dry. Do you use any product in the hair?
A little bit on the ends, but
Like this around here? Okay. I'm wondering if maybe that's slightly irritating. That's where it's mostly settling. But it's not anything that's, oh my goodness, of course, that's what's causing it. Just want to make sure we look for any moles. Freckles can hide in the scalp. We got to keep an eye on those. Behind the ear as well. Any pain in the scalp?
Mm.
Okay. Just feeling for lumps or spots here. Let me check the other side. Okay, same thing over here. There's just a smidge more redness and irritation on this side.
Mm.
Head up for me, please. Gonna be feeling again. I just want to check the hairline as well. It does look like the hair has some color in it.
Mm.
Okay, is that something you've been doing for a while, or could that be causing new irritation?
I did dye my hair before, but I haven't in a long time.
Okay. While I'm up here, I'm just going to check the eyebrows. Good. And no excessive hair growth on the face or anything like that. Skin is nice and clear as well. Okay. Lucky you. All right. So keep the eyes closed. Checking out the face. Any pain with this?
Mm-mm.
Here. Okay, I want you to open your mouth gently for me. I'm just going to look at the sinuses. Same thing on this side. Okay, you can relax. Let me know if there's any pain or discomfort during any of this. Can you open and close for me? One more time. Clench the teeth. Okay, good. Just feeling for lymph nodes. So working down occipital chain. You swallow for me? Good. Head down all the way as far as it can go. Does that cause any worsening in that area here?
Maybe a little bit, but not too much.
What about on the spine? Is that painful right on that tip? No? Okay. All right. Keep your head there. Don't let me push it. Okay. Come back all the way as far as you can go. How about that? If that increase your discomfort at all?
Yeah, I would say so.
Okay. Okay, just push forward on me. And now relax out of that discomfort position. Just feeling quickly for any deviation of the spine. That would be... I actually have a bit of kyphosis, not just in the top here, but the back of the spine. So you're bent a little bit at the mid-back. It's not too bad, though. It's not bothering you, then. Everybody's just made a little different.
Yeah. I also always do not sit up straight. That's probably
Could come from that as well, posturally. Yeah. But it could also basically be So you have these muscles on the side of your spine,
Mm-hmm.
and they go all the way up, and they sort of nestle in with these trapezius muscles up here, and the muscles that come down from the neck. And if these are pulling, because you're sort of hunched like this, it's creating this tension right here. So that could be definitely part of it. But all right, we'll keep moving. We'll just make sure there's nothing neurological. So turn your head towards me. Any pain with that? This way. Good. Shrug your shoulders for me. Keep them up. Very good. So that's nice and strong. So that's excellent. Okay, I'm going to look into the eyes. So I'll have you look just straight ahead right over there, please. And this will be bright. I do apologize. I'm just looking for the reflexes. Okay. Can you see the tip of this pen here? Okay, follow it everywhere it goes, just moving your eyes. Any blurriness with that? Okay, so you said you had some issues with seeing far away. Can you see that there? Any blurriness? Okay, now look here. Good. Make you cross-eyed. All right. I will give you this. Just cover up one eye. Make a choice. Whichever one first. Perfect. Then look straight at me and stare at my nose, okay? And tell me when you can see my fingers starting to wiggle.
No.
Good.
No. No.
Stay there.
No. No. No.
Very good. Switch eyes for me, please. Again, stare straight at my nose. You're fine.
No.
Good.
No. No.
Okay, I'm going to switch my hands here. Keep looking at my nose.
No. No. No.
Okay, that's good. Tell me what color my shirt is here.
Pink.
Okay, what about your pants?
Burgundy. Red.
Specific, but yes, that's perfect. And then the color of that door.
Brown.
Okay, so no issues with color then. All right, I'm going to do a test of the eye here. So just, again, look straight that way. Just looking for the blink reflex. It's not super strong, actually. That's okay. Let me just pull a little bit more of this out here. Try it on this side. Oh, yeah, there we go. Okay, let me try it again over here. I just didn't have quite the right cotton wisp. Okay, perfect. That's exactly what we're looking for, is that blink. Okay, let me look in the back of the eyes now. Okay, it's all fine. While I have this out, we'll take a look at the nose and the mouth. Okay, so I'm going to tilt you up here just gently. You have a piercing in there, but that looks really well healed. Okay, cover one nose for me. Take a breath in and relax. Cover the other one. Good. Sounds like you can breathe through both nostrils there. Okay. Any pain here?
No.
Piercings are all okay in the back.
That one is less healed than my other ones. But
This one here? How recent is that?
I got it in July.
Okay, so it's still pretty fresh. It might take some time.
Yeah.
Okay, well, it looks like the rest of your piercings are healing, so it's not like your ears are used to rejecting. Is anything fresh over here I should avoid? Okay. Okay. And have you close your eyes. And we're just going to make a little sound next to your ear, and I want you to tell me which side you hear it on, left, right, or both.
Left. Both. Right.
Okay, you hear that? Tell me when it goes away. Okay.
No.
Which is closer to you? This one or this one?
The second.
Perfect. Here, closer.
First one.
Okay. Just checking for depth of hearing there. Which side do you hear that buzzing on?
The left one, I think.
Okay. Try that. What about that? Left, right, or equal?
Equal.
Good. Do you hear that back there?
A little bit.
Tell me when it's completely gone.
No.
And do you still hear it there? Tell me when it's completely gone.
No.
Good. Same thing. Tell me when it goes away.
No.
Okay. Yeah, so 8 seconds on both sides. That's great. Okay. Open the mouth for me and say ah. You stick out your tongue. Side to side, move it this way, that way. Good. So you can see it back in. Press against me right here and against me right here. I'm going to put some gloves on, so we'll check out the sores, if there's any. Do you know if you have any actives right now? You do?
I do.
Go.
Not too bad, though.
And some people are just prone to them. There's nothing you're doing wrong, just some people are more prone to cavities, some people are more prone to canker sores. Some people are more prone to acne.
Yeah.
Not you. Yeah, we each have our things. Okay, so I'm going to just have you open the mouth. There's one little one there. Everything else looks okay. Look. Open again. Okay. So what, they don't look infected, they don't look too bad basically, but what we want to do is make sure that you're not uncomfortable. So I'm gonna suggest and I'll leave it with the front desk, a bit of a numbing spray that's also gonna, let's try the one without, like a steroid first. And try to avoid that if we can, and just see if it's just bothering you less, you might mess with it a little less in the mouth, and like that'll allow the healing process to continue. Okay, but we'll go from there. We'll see. Okay, I'm gonna do some cranial nerves now. So can you make a nice big smile for me? Okay, perfect. And lift your eyebrows nice and high. Keep them there, and relax the face. Puff the cheeks out. Don't let me push them in. Just checking for strength on both sides. Okay, hold your fingers up like this. Don't let me pull them out. Very good. Arms up like this. Don't let me push. Pull. Good. Up like this. Nice and strong. Clearly you work out a little bit. Perfect. Okay, so strength is fine. This with your fingers. Just checking some neuro things. A little faster. Okay. And can you, on the other side, might be a little harder if it's non-dominant. Okay. Take this foot and run it down this knee, if you can. Yep, exactly. Like this, yep.
Oh, like this? Wait.
Like this?
Oh, just like this.
Yep. And down this one, down this. Okay, that's fine. Arms out straight. Close the eyes. I'm going to have you relax and stand up for me with your eyes open at first, and just stand there and then close your eyes again. Okay, and relax. So that's fine, there's no balance issues. Go ahead and hop back up there. Okay, touch your finger to my finger And then to your nose, please. And then over here. And now your nose. And over here. And now your nose. Good. Can you try the other side? There you go. We're looking for hand-eye coordination, basically how the brain is talking to the body. Right. You did great. Okay, let's do some sensory testing now. So I'll start with a little cotton ball and just have you say yes when you feel it. Close the eyes.
Yes. 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 Yes.
Okay, did it feel the same all the way down here?
Mm-hmm.
Any tingling or numbness in the hands when I did that?
Mm-hmm.
Okay. So next we'll do a sharp or dull test. So I have a dull little cotton swab here versus a sharper tool. You feel the difference?
Mm-hmm.
Okay, tell me what you feel.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp.
Mm-hmm.
Sharp. Sharp. Dull. Dull.
Okay, I'm gonna work my way down the arms.
Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Okay. You can open your eyes. I'm going to put those down for you. I'm going to be drawing a number in your hand. I want you to tell me what it is. Either look away or close the eyes.
Okay. 3.
Okay, I'll do the same thing on the other side.
2.
Yep, and add those together for me.
5.
Okay. Got a few more tests here. So I'm going to move your finger at the joint, up or down like that. Tell me what you feel.
Down. Down. Up. Down.
Okay.
Down. Up. Up.
Okay, very good. So I'm going to do your reflexes. So this is going to be a little bit of a funny sensation here, but I just want you to give me as much weight as you can. So feeling for the tendon. Clench your teeth. 1, 2, 3. A little bit there. There we go. That one's nice and brisk. Oh. Yeah, feels funny, huh? Okay. Just look ahead for me. Ignore me. Okay. Again, relax completely. Over there. Okay. I'm gonna tap you here. Let the jaw hang for me, please. Okay, move down to the knees. There we go. It's a good one. It's excellent. Okay, push against me here. Push against me here. Up like this. Yeah, there you go. And pull me towards you. Any pain with that? Nothing radiating up the spine, right?
Mm-mm.
Okay. Would you be comfortable? I just want to check your back really quickly,
Mm-hmm.
just to make sure there's no nerve pain leading up to that spine.
Yeah.
Okay. I'll also just have you swing around here. So again, I just want to feel all the muscles here. I think it is just muscle tightness, but I'll be tapping in and around the spine, and I just want to make sure if you feel what you shouldn't feel is like electricity kind of radiating up or pain.
Okay.
If you feel just a little bit of pressure, that's normal, but let me know if you have any of that electricity. A little gentler on the spine now. Nothing there, right? Okay. So yeah, thinking it's just. Okay, lean forward for me all the way. And then come up sort of one vertebrae at a time. Really slow. Come back down and come up really slow. Yeah. Okay. All right, go ahead and swing back around. And we'll finish up with your exam. So, Tova, basically, we have a couple of issues we want to tackle, nothing super urgent, but I think we should address them and then have you back actually in 1 year, not 2 years.
Okay.
I want to get your back looked at, probably get you an x-ray first just to make sure there's nothing going on there. I don't think so, but then we can recommend you for medical massage as well as physical therapy, which can help strengthen some of those spinal muscles, get you sitting up a little straighter. But our modern life unfortunately does lend itself to this issue, so it's pretty common. And then we'll get you that numbing cream for the mouth, and we'll see if that helps a little bit. If not, we can try something more intense. If your eyes change at all, like if the far side gets more blurry or harder to see, let us know. We can send you out to get your eyes a full eye exam, okay?
Okay.
Any questions for me today?
I don't think so.
Okay, well, thank you so much for your time. It was lovely to meet you, and we'll see you very soon.
Sounds good. Thank you.